Teeth Today has set the standard for tooth replacement using dental implant treatment as an essential part of aesthetic dentistry and dental health. With us now is Dr. Jeff Ganeles. Doctor, please tell us about your practice.
Teeth Today started with a desire that my patients expressed to me in the early 90s that they didn't want to wait for their teeth after implants were placed. And the science and the techniques developed during the 90s so that we were able to predictably place teeth on implants and get patients working and get them smiling and get them chewing almost immediately. So it's been a huge benefit to our patients, and it's been a great addition to our practice over the years.
How long has your center been here?
I've been in practice in this location for over 20 years, and I hope to be here a lot longer.
Dr. Ganeles, how many patients do you have?
We've treated thousands of patients with Teeth Today since the mid-90s, and the practice has been here for over 40 years. I've been part of it for over 20 years.
With regard to immediate loading, what is unique about your approach?
I know our practice is unique in providing these Teeth Today services because I speak all over the country and all over the world. And I know that very few practices and very few doctors have their patients walk out of their offices with teeth with the same frequency that we do. We have a policy here, it's almost a motto or a mantra for our office, that nobody leaves here without teeth. And we really believe it, and we work hard to make sure that happens. And what's more, it happens predictably, without a lot of drama, without a lot of fanfare. Other offices make a lot of representations that this is exotic or special. It's routine for us. We do it all the time.
How do your patients find out about your center?
Patients find out about us through a lot of different ways. Some are referred by their dentists, some are referred by other specialists, some people find out about us through their friends, others find out about us on the internet. There's a lot of information about what we do all over the place, and it's hard to figure out sometimes where people come from.
Please tell us about the benefits of dental implants as compared to the older conventional alternatives.
Dental implants are designed to replace the roots of teeth that are missing. And because of that, they provide new support for replacement teeth, for crowns or for fixed bridges, or even at sometimes removable bridges. They are stimulating to the underlying jawbone, so they actually promote bone health, and they're much stronger than using natural teeth to support crowns or bridges or some kind of removable devices. Dental implants probably last a lot longer than any conventional kind of dentistry does. Dental implants don't require that adjacent teeth be damaged. Once enamel is removed from a tooth, it never comes back, and that usually causes deterioration. It causes the need for future treatment. When implants are done well and they're healthy, they can stay there almost forever.
Please tell us more about the benefits.
There's a lot of benefits to having a healthy mouth, whether it's done with implant dentistry or other methods. People that have ongoing dental disease have all sorts of other health issues associated with it. There's no question that there's an association between bad dental health and diabetes, or bad dental health and cardiovascular disease. There are probably some associations between bad dental health and Alzheimer's disease. There may even be associations between bad dental health and obesity. By treating the underlying dental problems, we can certainly make someone healthier overall. Now, we also know that there are some very interesting associations between good dentistry or good dental health and longevity. For instance, if you're 70 years old and you've lost all your teeth, your 5-year mortality is almost twice that of someone who hasn't lost their teeth, who has good dental health. We don't know for sure that replacing those teeth with implant dentistry is going to make you live longer, but it certainly is going to make you live happier, and it's going to make you more confident and more robust in your social interactions.
What can be done for someone who is missing one or several or all of their teeth?
If you're missing one tooth, it can almost always be replaced with a dental implant supported crown. And that's something that's a fairly routine practice in our office these days. Same thing holds true if you're missing many teeth. It's relatively easy to replace a few teeth with implant supported crowns. If you're missing all your teeth, we have special procedures that can do that very quickly and very efficiently as well. The key is getting a proper diagnosis, getting a good plan, and getting some skilled help to help provide these treatment options.
Tell us about the technology implemented in your practice.
We have all sorts of technology these days that help us accurately diagnose and then properly plan treatment for patients. We routinely use cone beam computed tomography, also known as a CBCT, which gives us a three-dimensional picture of someone's jawbones. With that, we find where the strength is, where the weaknesses are, and we can also avoid nerves and sinuses and other areas that we don't belong. We also can use that information to accurately plan positions for implants, and that's called computer-guided surgery or computer planning. We also make surgical guides based on that computer technology so that we can position those implants exactly where we want them safely and very atraumatically. A lot of times when we use this technology, we can place implants even without opening the gum. So there's no stitches, there's almost no pain, and the healing time is very quick on these.
What happens when patients first come to your practice?
When patients first come into the office, we know that they're always a little anxious, so we try to go out of our way to make them feel welcome, feel at home, and feel safe, because we know that this is one of their big issues. A lot of people get into dental trouble because they're not comfortable in dental offices in the first place. So our office is designed to have kind of a warm, cozy, but professional feel to it. We take a thorough medical history because we need to know what your health status is, we need to know what medications you're taking, we need to know what you're allergic to. We will do a thorough examination of your mouth and make sure we know what teeth are there or are missing, what kind of condition those teeth are in, and whether they can be counted on to stay healthy for the future. We also do an oral cancer screening because oral cancer is one of the types of cancer that unfortunately is increasing in our population, so we want to make sure that there's nothing else going on there. We'll look at your neck, we'll look at your jaw joint, make sure there's no facial pain, and we'll also probably take some kind of x-ray. Usually that's going to be a cone beam computed tomography or a type of CAT scan, which gives us a three-dimensional view of what your jawbones look like.
Why is it important to know all about the condition of a patient's jawbone before going forward with treatment?
It's very important to know the shape and the density of the jawbone before any treatment is done, because that has a big impact on the success of treatment. If there isn't enough bone, we have all sorts of techniques that can change that or improve that, but we need to know it up front. If the jawbone is porous or there's some osteoporosis there, we also need to know that, because again there are some methods we can use that can compensate for those underlying problems. The success of implant dentistry in the long run really depends on how solidly those implants are placed to begin with. And it is very important to have that information before we get started with treatment. One of the big problems that patients come to us about is problems after they've had treatment. And typically the big reason that patients run into problems is because they never had a good diagnosis in the first place. We don't want to have surprises. We want to make sure we know what to expect when we get into treating someone, and a thorough diagnosis is the key to making sure that you are treated safely and predictably.
What patients do you typically treat?
The perfect patient for us is someone who is either missing a tooth or is about to lose a tooth. Other than that, we can treat almost anybody. We tend not to put implants in growing children. We tend not to put implants in patients who have very fragile health. On the other hand, we do put implants in patients that are older than 100, and they do really well. We put implants in patients that have controlled conditions like controlled diabetes, controlled heart disease, controlled hypertension, controlled kidney disease, controlled metabolic problems. All of these people can be treated safely and effectively and predictably.
Teeth Today is more than just a dental implant center. It's also a periodontal practice. Please tell us about that.
All the doctors at this Teeth Today center are board-certified periodontists. As periodontists, our specialty is to treat teeth and gum disease or replace teeth that are missing from gum disease. Teeth Today really addresses the replacement side of what we do. On the other hand, we have a very robust practice where we also take care of gum problems. So if patients have loose teeth, often we can strengthen them or tighten them. We can manage gum disease. There are all sorts of procedures we have to fix gum recession, to grow bone back around teeth if it's not too bad. And we can restore someone's dental health without taking their teeth out an awful lot of time.
I understand that some patients coming here expect they'll need implants, but you might instead find that periodontal treatment may be all they need. Is that so?
One of the strengths of our practice is the fact that we're periodontists, so we have this mission to save teeth that can be saved. So if you come in here, we're going to look at you with the idea that we're going to try to save your teeth first. We're not locked into the idea that we have to replace teeth all the time. We have lots of treatment options and treatment styles available. So we're going to customize treatment to your individual problem. That means that if you have teeth and they're weak, we're going to look at strengthening them first. If we can't strengthen them, then we're going to look at replacing them, and that's where Teeth Today comes in.
How much of your practice is with implants and how much with periodontal treatment?
About 2/3 of our practice is related to tooth replacement or implant dentistry. The other third is related to saving teeth and managing periodontal problems, which means that we fix gum disease, we can tighten or help tighten loose teeth, and a lot of times we can regenerate bone around teeth that have underlying bone loss. So we have very different options available depending on the patient's problem.
Back to implants. Please tell us about the All-on-4.
All-on-4 is the trade name of a style of treatment for patients who are missing all their teeth in one arch. The process requires placement of 4 implants around the jaw and then activation or loading of those implants with a one-piece screw-retained fixed bridge. The benefit of this is it's a very efficient use of implants because you only need 4 to replace a full arch of teeth. The other benefit is that it is designed to really make the best use of a patient's available bone. It generally avoids the need to do bone grafts, and many people that have lost their teeth also lose the bone along with it. A lot of people are under the impression that they can't have implants done because they don't have enough bone. All-on-4 often allows us to overcome that problem without doing any bone grafts. It's only one of several different techniques that we use for patients that are missing teeth. It happens to be one that is gaining in popularity because it is fairly time efficient, cost efficient, and easy for patients to undergo. And there are some very sophisticated applications we can use it for.
Please tell us about dentures.
Dentures are a plastic set of teeth that you put in your mouth and sort of fit over the gums to replace missing teeth. The lower denture is generally held in by gravity. The upper denture sometimes is held in by suction. A lot of people use denture adhesive to hold those dentures into place and prevent them from moving too much. And there are all sorts of problems with the dentures, the adhesive, and the whole concept of dentures. Dentures generally are not too comfortable because they tend to move around a lot. So patients often don't have very good chewing ability with them, and they can't have fresh fruits and vegetables, and their diets tend to deteriorate. Dentures cover the roof of the mouth, so it tends to reduce a patient's taste sensation, and it also reduces their mouthfeel of foods because the palate is covered by plastic. Dentures sometimes cause patients to alter their speech patterns because it covers the roof of their mouth. A lot of patients talk about the embarrassment they have when dentures slip or move, and it's particularly unattractive to think that dentures may move when you're kissing somebody, or a fear and loss of intimacy as a result of that. So dentures have all sorts of problems. The only advantage of dentures are that they're relatively inexpensive.